Good morning. This presentation outlines an implementation plan for targeting obesity in Irish schools using health promotion programmes. A brief welcome to the Minister of Education and Skills and the Minister for Health here in Ireland. I'm then going to discuss the problem, what the evidence suggests, the intended outcomes, the Irish context and barriers to implementation, proposed solutions, the implementation plan, monitoring and evaluation, and then time for questions. So the problem here in Ireland is that we face a dramatic increase in childhood obesity. In 2011, the HSE did publish an overarching framework for health promotion in primary and secondary level schools. However, by 2015, only some schools were implementing the programmes, and the research shows that considerable room for improvement is evident, and only inconsistent findings on the effectiveness of these programmes are available in terms of childhood obesity. While the HSE did acknowledge the importance of health promotion in these schools, they did not provide any specific guidelines for schools or teachers to carry out these programmes. There's also a risk here in the country of overspending, and health promotion programmes in schools, according to the research, can be cost effective, looking at programmes worth €12,650 versus indirect and direct costs of obesity in the Republic of Ireland at €1.13 billion. So what does the evidence suggest? At primary level, including both nutritional and physical education combined within a health promotion programme in schools can be effective in reducing childhood obesity. Furthermore, the inclusion of key stakeholders such as teachers, parents and the government is essential in carrying out these programmes. However, in terms of secondary level schools, the literature does not support the effectiveness of these programmes and further research is required. Therefore, as this supporting evidence is outstanding for both the school groups, an overarching and national healthy schools promotion programme is, as originally hoped by the Department of Health, is unlikely to be beneficial at this time. So what is our intended outcome? We would like all Irish primary school children to have equal access to a universal evidence-based obesity prevention programme in schools. We would like teachers and schools to be wholly supported in carrying out these programmes, and we would also like the government to consider further research to be commissioned in terms of the second level schools. In terms of the Irish context and barriers, just to highlight, in the brief, a lot of European schools were discussed, including only one Irish study. So just to highlight, in Ireland, cafeterias are not common in Irish schools, and that should be considered in the implementation plan. Some likely barriers to implementation include an overloaded workforce and resistance, lack of resources and supports for schools, lack of education to staff, funding, and the awareness of importance of health promotion in schools and prioritisation. So looking at a proposed solution and an implementation plan. Number 1, design a universal evidence-based health promotion programme for all Irish primary schools. Here, the Minister for Education and Skills is involved, and also the Minister for Health. This should be completed by May 2019, and the result would be a universal equal access of health promotion to all primary school children in Ireland. Solution 2 would be to fund all appropriate resources and supports for schools carrying out these programmes. Again, the two ministers are involved in the same deadline date of May 2019. This would overall improve teacher competence and confidence in carrying out these programmes. Solution 3 would be to educate schools and teachers on the health promotion programmes and provide protected time to carry out these programmes. Again, the two ministers are involved, and the training was recommended to be carried out between June 2019 and September 2019. Overall, the result will be to increase knowledge, evidence base, confidence and competence, increase programme compliance and reduce resistance. Number 4 would be to educate parents. All schools here are involved in this solution, and the deadline would be September 2019. This would encourage children carrying out these health promotion practices outside of school and also make parents aware of the school's priorities. Number 5 would be to pilot the programme. Again, all primary school principals, teachers and designated coordinators are involved here. The timeline would be the entire school duration, 2019, September to June 2020, and the benefit here would be to evaluate. In terms of monitoring and evaluation, there will be a pre and post qualitative and quantitative evaluation involving key stakeholders. We're looking at student evaluation, parental evaluation, teachers, schools evaluation, and including the designated coordinator evaluation. All evaluations will then be submitted to relevant governmental departments for review. Please see here a list of references used to compose this presentation. Thank you very much for listening. All questions are welcome. Thank you.